We got stuck in an elevator together. We're going down.
Oh wow! Can you hit my floor? I'm going to X.
X. Whoa, make one up. All right, X. Perfect. I like it.
Great. So what do you do?
Well, that's a long story. I don't know if we have time enough in this elevator for that, but I'm basically a physician that does a lot of work around design thinking and leadership in healthcare. So
you're trying to make the world a better place.
that's the goal.
What if I gave you an opportunity to do that today?
Oh wow. Yeah. Cool.
Somebody in the world every 7 seconds dies from diabetes. The International Federation of Diabetes has this stat.
Yeah, wow.
Now in California, UCLA in 2016 found that 46% of the population is pre-diabetic. And the kicker is that 9 out of 10 do not know it. So I founded a startup called InPhood, and what we do is we use text messaging because it's accessible to everybody. And the other thing about text messaging is people respond to it. They don't respond to mail anymore, they don't respond to phone calls, and they certainly don't respond to email. And what we do is we basically hit them with text messaging as a way of providing a bridge between marketing and treatment. And what happens is they can take a risk test from the American Diabetes Association, and if they find out they're at risk, we can actually help them take action today by engaging in a diabetes prevention program. And the thing that I really need your help to do to get this off the ground is we're looking for people in public and private health plans that we can talk to about using our solution to see if it boosts their efficacy efforts in this regard.
Cool. Okay, yeah, before we, I'd love to, if this makes sense, I'd love to introduce you to some people. But one of the things that I've found that is people don't believe it's a problem until it's a problem, right? So, like, I'm not worried about lung cancer, for example, for myself, and not likely to get screened for it until I have something that makes it a problem, right? So you're looking at a big population that is pre-diabetic. So I guess if you can just get a few of them, that would be a win. But what is the incentive for people to kind of do this?
Let me flip that on its head.
Sure.
California, about 40 million people.
Yeah.
Half of them, 20 million. You can't get everybody. But if you can even put a small dent in that, and you can find people who aren't in denial, and actually find out that they can do something about this, because the people we've talked to, many of them don't think they can do anything. They think it's genetic. They don't actually know that there's a treatment program that's been shown to be up to 70% effective in some cases that allows them to change their lifestyle. If you can just hit those people, you can save health plans quite a bit, and you can actually start to stem this death from diabetes that we're seeing across the board. So you're right. There are people that are in denial about it, and they're going to need to have that, for lack of a better term, car accident with diabetes when they actually find out that they are. But if you can get to some people beforehand and just kind of start to build that awareness, and you can get a few people there, then it starts to spread via social media and other things, and people find out, hey, this is more common.
Right. Well, you said something I think that's actually really interesting. So there is a segment of population that you can target. I was actually in this elevator a little bit ago talking to someone else. It's really ironic about trying to do a one-size-fits-all. That doesn't work. And so in this, like, capturing this wide net of everyone that might be pre-diabetic, that might be a harder kind of, there might be a lot of holes in that net. But there's a population that you might be interested in targeting is people who are children of people with diabetes, right? That they're sort of already kind of feeling maybe there's a risk, maybe some of the things you were saying, like, oh, it's genetic, so maybe the fear's on their mind. So that's an interesting thought. How does that sound to you as far as?
Oh, it sounds absolutely wonderful. Okay. And we've actually thought about the reverse too, intent-based marketing. So if you're trying to sell somebody a video game, do you market it to the person, or do you market to the person who's going to buy it to them for Christmas?
So who are you?
It's a strategy along the lines of what you're
that's
talking
great.
about.
So
you also see it when people are selling to children, to people who are about to be parents. Okay. They'll go for the grandparents because they kind of want to help out, buy a child's seat, things like that.
So what do you think the value add is? What do you think the value of the product, the real value?
The value of this product is that the mechanism today is to show people an advertisement on YouTube or something. And there's no bridge from that to an option where they can take action. There's nothing in that advertisement that says, hey, you're at risk, and this is what you can do about it now. So the value add is to basically start reducing the costs for the people in these plans by engaging them directly with a mechanism that they engage with, text messaging, and getting them to understand that they can actually take action and do something from it.
So who are you texting? You're reaching out,
We
like
would be
proactively
texting plan members. There's similar precedent for this today. So to give you an example, health plan of San Mateo.
Okay.
It would be a HIPAA violation to take all the people who would be at risk and so on and so forth. But what you could do is say
Just blanket text everybody?
exactly. And another thing that you can do is also provide an opt-out mechanism as well.
Okay.
And there's precedent. They've done this for other programs.
have they found some efficacy around it?
Yes, there's 2 programs, cervical cancer screening and postnatal care, where they were using text messaging and finding improvements with regard to engagement.
Okay.
Now, on the diabetes front, there's another company that's also post-care.
Wait, I'm hearing the elevator coming to a stop. But quickly, what's the intervention they need to do to kind of get screened? Like, is it a blood test? Is it a... Like
It's an
text
A1C blood test. That's
okay,
considered
so you get the
gold
text
standard.
message and then you're gonna go get an A1C measure.
Yeah.
Okay, so that's another kind of like...
Unless you're not in a
idea.
public health plan. If you're in a private plan, oftentimes...
That's a hurdle that you might kind of want to figure out how you're gonna bridge that, because the text message almost sounds like more targeted advertising, but as opposed to the YouTube video. But there's still kind of like, you need to go get your finger pricked or whatnot, or your blood drawn. But, oh, here we are. Sorry.
Thank you, Alex. Are there any questions for Alex? Yes.
Great presentation, Alex. Love the idea. Heard it a couple of times. You know, one thing that just got to my mind, or 2 ideas kind of floated to my mind. One was public health fairs and like the opportunity here, and I think we talked about that. Another thing that started floating in my mind is, you know, as we're talking about different markets and public health plans, pharmaceuticals would probably love this too. I mean, you imagine you have a commercial for Januvia or the other new, really expensive, fancy oral anti-glycemics. They would love to spread the gospel about their medications and get more folks to buy their stuff. And gosh, if you could market to a pharmaceutical, that could be another interesting.
Great idea, thank you.
Well, you might be undercutting their business, right? Like you're curing diabetes before they start taking their medications.
Alex, thanks. I took the survey. It's actually quite quick and easy. Do you have any concerns about what if an insurance company just made the text service themselves as well, since they have money and they have all the patients under their network already?
It's certainly possible. What we've seen so far is in public health plans, they do seem to use contractors, and they have a specific list that they use that have worked with public health plans, so getting on that list is kind of a prime concern. But I think you're going to find with a Humana or like a Kaiser or an Aetna, they're definitely playing in that space already.
Thank you.
Any last questions? Okay, thank you. Thank you, Alex.